Here we go. So good evening, everybody, and thank you so much for joining us at Secular AZ today. We are a nonprofit organization focused on protecting the Constitution and the separation of church and state for over a decade. We have some great programming, including candidate forums, our speaker series of events where we talk about church-state issues with doctors, lawyers, historians, authors, union leaders, advocacy groups, legislators, and others. There's many more that are coming up, including a discussion about religious cults and indoctrination with some folks also who have gone through the deprogramming process of being brought up in religious cults. And that will be happening at our Secular Summit happening in December. So if there's somebody you'd like to hear from, or if you have personal connections to prominent freethinkers that you can connect us with, please reach out to info@secularaz.org. So tonight, I'm really excited about this discussion. We are going to be talking about accessing healthcare in a post-Roe Arizona. And joining us is Chris Love, former board chair of Planned Parenthood AZ, Jess Grennan, Director of Healthcare Rising AZ, and Angela Schultz of Compassion and Choices. We're going to chat for a little while. And if anybody has any questions, please put them into the Q&A, or if you're on Facebook, go ahead and put them in there. I'm going to look at everybody's tiles as I see them and just go that direction. So I am looking at Jess. Oh, actually, I'm looking at Angela first. So Angela, is there anything in your bio that you would maybe like to add with regards to your work with Compassion and Choices?
Hi, everyone. I'm Angela, and I'm the Southwest Regional Advocacy Manager. So I cover all the Southwest states except Nevada, and I also cover California, but I actually live here in Phoenix. And so we do end-of-life care advocacy across the country. We're a national nonprofit. Thanks.
And then next I see Jess. So Jess, if there's anything you'd like to add about your role with Healthcare AZ, Healthcare Rising.
Hi, I'm Jess Grennan. I'm the Political Director of Healthcare Rising Arizona. I'm also the lead on passing Proposition 209, the Predatory Debt Collection Protection Act. And it's very strange for me to not be the Compassion and Choices person on the phone, since I worked for that organization for 7 years. Managing the national advocacy directing the national advocacy program and passing the ballot measure in Colorado that won in every county in the state, including the county where Focus in the Family is based out of. So pretty exciting.
Moxie, stop, please. All right. Thank you. Thank you, Jess. Chris, go ahead. If there's anything I missed that you want to add, please go ahead and add it.
I think you mentioned the most fun thing about me these days. I am the immediate past chair of Planned Parenthood Advocates of Arizona, which is the political organization that supports the work of our Planned Parenthood clinics throughout the state. I'm also an attorney. I am a mom. It is spooky season, so it's the most wonderful time of the year. And as always, I'm so happy to speak with the Secular AZ crowd.
I'm trying to find our event on Facebook, and for some reason I'm having like the hardest time doing it. So I'll get to it eventually. Yeah, watch out. People watching this show are, now gonna write a blog that nobody reads about you being a Satanist. So good times.
Can you send me a copy of that?
All right. So this conversation actually came about because back in September or something like that, I was maybe even August, I was talking to Jess about an unrelated issue. And, we were just talking about healthcare stuff. And she said, just watch, things are going to get weird now with Roe, and that it is going to have overarching effects on everybody in healthcare and everybody who's trying to access healthcare, and not just reproductive healthcare. And I was like, what? That's not going to happen. But then a couple weeks later, Texas announced that employers didn't have to cover PrEP medication if it goes against their religious beliefs. And so I was like, wow, okay, I'm starting to see some connections. And then there was another case in Tucson with a a 14-year-old girl who was trying to access her medication to treat her rheumatoid arthritis and osteoporosis. And the pharmacist, I guess, was worried about violating laws. So, so here we are now. I'm going to go ahead and start with the question that has the vocabulary word on there. And this one comes from our head legal, Diane Post. And it says, was using, and by the way, if anybody has any questions, you can put them up in the Q&A if you're on the webinar or on Facebook. So her question is, and let's just do this, whoever wants to answer first. We've all been in Zoom meetings for far too long now, and we all know Zoom etiquette. So was using the penumbra of the 9th Amendment for privacy rights the strongest footing we could have done for ensuring individuals have autonomy to make their own medical choices? And I'm guessing, Chris, we're going to start with you on that one. And if you could maybe even help us with that vocabulary word.
You do my visual aid. So in deciding Roe versus Wade, the court said something about the penumbras of the 9th Amendment creating a right to privacy, right? And so penumbras is just a fancy schmancy word for like the beams that come from the sun. So it's saying that there's something in the 9th Amendment. The 9th Amendment might not necessarily be or explicitly be about a right to privacy. However, from everything that comes from the 9th Amendment, we can imply that a right to privacy reaches out from that 9th Amendment, right? And the answer to that question is hell no, because we're here now. We should have never been reliant on a Supreme Court precedent to affirm everyone's bodily autonomy, right? I think that, and seeing Dobbs and the way that people reacted to Dobbs, the shock and surprise from folks is really kind of alarming for me, because, I think people in the repro movement knew that this was always a possibility and it was coming, which is why there was such a push to try to codify, at the very least, codify Roe, which was always the floor, not the ceiling. But at the same time, I think we've seen, I was listening to one of the New York Times podcasts one day, and they talked about the legalization of abortion in Mexico and how the women that were working on that legalization, they had their own Supreme Court case that did the deal for them in the same way. But they immediately recognized that they couldn't rely on the court precedent. They couldn't just rely on the court precedent. So they started doing things like ensuring that people had access to medication abortion immediately, right? And doing those things and creating the network so that folks would always have access to abortion, even if there wasn't a necessity for a doctor to perform an abortion, because they saw how kind of temporary that Supreme Court precedent could be. And I think that where we made the mistake in our movement here in America is that we were too reliant on, a perfect storm of things happening, right? Like it's precedent, it's been happening for 50 years. But then we've seen all of the things that have happened in those intervening 50 years, where we've seen the right to abortion just be picked at and chipped away constantly. And then we saw all of the things that were happening around us, like Citizens United. We saw what was happening with the Voting Rights Act and the most important provisions of the Voting Rights Act being overturned. We saw, obviously encroaching to the right of our American politics, and that allowed for Donald Trump to be elected, and then for, the appointment of 3 Supreme Court justices, right? And so all of those things didn't necessarily happen in rapid succession, right? They were 50 years in the making. But I think that what we did was we just held on to this belief that, Supreme Court precedent is precedent. And that's what it's going to be, and it will never change. And, I just don't trust anyone, right, to ensure that my bodily autonomy is protected. And certainly not folks on the Supreme Court who are so far removed from the issue at the point where they're serving that, it was just, it was a bad strategy for us. I will say that. I think that codifying our rights would have been a better strategy, but I also think that we needed to do more than just Roe.
And I don't know, I don't know if Angela or Jess, if you want to weigh in on this one too, but please, by all means.
Yeah, I was actually, while Chris was talking, and I think Chris will have most of the points on this, but in Montana, where I'm from, we have a right to privacy in the Montana Constitution, that we have it enshrined in our Constitution. So abortion is legal in Montana, where a lot of other states that have a similar political makeup to Montana, it's not legal, even with the Roe decision. And I think that's really important, is that enshrining that right to privacy in medical decisions is going to be real important. And also to Chris's point about, I think being overly reliant on Roe was something that, we need to be aware of. Like, having your rights decided by the Supreme Court only is just, I think it gets real messy. And it's like Chris and I were talking about, we were preparing for this call earlier, and I just had a surgery last week. And I'm like, I damn well don't want those. Well, I had some choice words that I won't say on this call that I shared with Chris, deciding on how, I had an ovary removed last week for medical reasons. And I'm like, why was that? Like, that should not be voted on by legislators or courts and stuff. And like, this is a medical standard of care issue. And I see Eva Birch is on the call, I know. So we definitely have some folks in the healthcare industry, but I think it's just real important, like, that we need to keep looking at new ways to make sure that we're ensuring citizens' rights. And, in Arizona, especially, they are going after the ballot measures in Arizona, because that's the place where the most progressive change has happened in Arizona. Arizona passed, Angela, I just actually found this out recently. Arizona passed in the 90s a Death with Dignity Act, End of Life Choices Act. And, then it got overturned by the legislature, and so we see that the folks that are elected, because we can't always elect some of the great people we have on this call in every district in Arizona, but we see that happening, that, legislators want to take away rights and citizens support rights. And so I think, one of the things that I really want to discuss is how important it is that we oppose 128, 129, and 132 this year, because that's going to be the place where we can make sure that we're enshrining rights moving forward.
I just jump in to add that we do have a constitutional protection to the right of privacy in the Arizona.
Oh, you do?
Yes, we do. And I think we will probably see some cases based upon that, and trying to figure out what our abortion landscape looks like. Not right now, but I foresee it coming.
Oh, very cool.
That was going to be my follow-up question. Then Angela, I saw that you had unmuted yourself, so go ahead.
Oh, I was just going to say, so if you're not familiar with medical aid in dying, so it's medication that somebody can get a prescription from their doctor. It's only authorized in 11 jurisdictions, but you have to be terminally ill, have a diagnosis of 6 months or less to live, and be found mentally competent. And there's a whole bunch of other steps that go into it. But we actually had a case before the Supreme Court in 1997 that got denied. And so it got kicked back to the states, similar to what just happened. So we've been just going state by state trying to get it authorized. So we started, the first law went into effect in 1997 in Oregon. Not much happened until about 2014, until if you heard about Brittany Menard, she was the young girl who had the brain tumor, and she used it, and it was in People magazine and got a lot of like more mainstream coverage, I would say. And since then, like, states have been flipping. We get about like one every year. Jess is nodding her head because she used to work here, and helped with Colorado, got it authorized in Colorado. So it is something that we've also struggled with. It's just going state by state and still getting challenged in every state. We have lawsuits all over. So.
And, there's no shortage of state legislatures and assemblies to keep you busy with that kind of work. So, they wield an awful lot of power, and those races are super, super important. I heard a story from before my time at Secular AZ, and it was a, former legislator in Arizona. And somebody from, it could have been Compassion and Choices or AZELO, Arizona End of Life Options. I'm not sure who it was, but they gave an informative session about, death with dignity and what their group hoped to be able to bring to people and to the bill that they put forward in the legislature. And this gentleman, who no longer is with the legislature, had shared a story about his mother-in-law going through a very, very painful death, right? Like, it was agonizing, it was awful, but that he still wouldn't support it because Jesus died on the cross. And so Jesus suffered on the cross, and Jesus wanted us to suffer too. And so we shouldn't have those kinds of things to ease our pain as we transition into whatever's next. So, again, bringing up the fact that somebody else's religion trumps my lack of religion or my own spirituality just doesn't really make any sense. So let's go ahead. I'm going to go ahead and move to the next question. Again, whoever wants to jump in, please, by all means. And this is a question that I know the vocabulary words. How does HIPAA play into the ability of patients to make decisions that their spouses or children or parents might not like? Don't all speak at once.
Well, I don't know about HIPAA, but I can tell you what I can tell you is that, in finding kind of the criminalization of reproductive health care options, which is essentially what's happening now, right? We're criminalizing pregnant bodies, we're criminalizing birth outcomes because we're criminalizing pregnant bodies, and those sorts of things, right? I can tell you that because of an environment where we don't have protections for abortion, we will see a spike in reports of any activity that would be deemed or looked illegal under these bans, whatever they are. And most of those reports come from family, friends, intimate partners, right? Now, that's not a HIPAA violation in and of itself, especially because we find that people share what they're doing with their loved ones, as they should, when they're making, when they're trying to make decisions for themselves about their reproductive futures. The problem is that once you've given that information away, you've provided that information, it's not coming from your healthcare provider, then that's where HIPAA does not play into this at all. And so one of the things that we've been talking to folks about specifically is being really careful about who you share, your reproductive choices with, who you share with that you're thinking about having an abortion, right? Because the folks that you think that you can rely on the most are the same folks who will turn around and report you to the authorities. And those are your loved ones, those are your intimate partners, those are your parents and your siblings and your family and your close friends.
And refresh my memory, because it was so confusing after this opinion came out and this reversal. I don't remember if we're one of the states that has that kind of vigilante aspect to it. We don't. Okay.
We're not. And it's only because we didn't pass the SB8, the Texas style SB8 style bill that was actually, it was there. It just didn't pass. We just passed a regular old flat 15 week with the only exception for the life of the mother.
It could pass in Arizona though.
Yeah, listen, they're all being real quiet about what they want to do right now because it's election time, but we've heard what they wanted to do before now. And we know that once the election is over, those kind of things will ramp up again.
And Arizona, because I think this is also an information session for a lot of people because it's been so confusing. It's like, oh, is it the territorial ban? Is it the 15-week ban? And plus we're hearing these stories from all over the country right now too. I know that the self-medicated abortion ban that I believe Bartow tried to put forward this last legislative session failed. So people can still access, the medication for abortion. Oh,
So, you know that in the 50 years since Roe versus Wade, Arizona has a very complex web of laws and regulations surrounding abortion. And part of those laws and regulations are a ban on telemedicine. So that means that abortion providers can't do anything over telemedicine, whereas you can do that just about for anything else. And there's also a ban on mailing and shipping abortifacients. So that means, yes, people can access abortion drugs. That just means that they can't have them sent to their houses in Arizona, where they live in Arizona. We don't recommend that people place orders in the state of Arizona. We recommend people leave the state, do what they need to do, and then come back. Because of the laws that we already have on the books, not even the reappearing territorial ban, not even the 15-week ban. Right. So I think we need to be very careful. Now, medication abortions generally don't happen after 15 weeks, but I think we need to be very careful about, requesting and shipping and receiving the abortion cocktail in the mail.
Okay, I'm gonna jump off the questions real quick because I want to know specifically from Angela and Jess. So how are these types of bans and this overarching micromanagement and distrust of medical professionals affect the two of you in the work that you do and the people that you serve?
I will turn it over to Angela first. Yeah, I think that's more appropriate there, but I'll think about an answer. Or you're going to buy time, Angela.
And if it's not affecting you now, like what do you see as the possibilities going forward for how it will affect the work that you do with the people that you serve?
I will say what we do see a lot is when we have, and I didn't really hear your whole question, but I think this will kind of answer it. So we will have, for medical aid and dying and other end-of-life option cares, a lot of times physicians have to abide by what the hospital policies are. And so if they're in a Catholic hospital, and often a patient doesn't know that they're in a Catholic hospital, like I have one doctor in Colorado who got fired just for having a conversation with their patient about what medical aid in dying is. And so it's like, these are their rights. Doctors can opt out of prescribing, and we specifically write the laws that way so that they have a better chance of passing. But part of that is they're supposed to document and refer to another doctor. And so they're not just leaving their patients, but doctors are being prohibited from even discussing some of this stuff with their patients. Does that answer your question?
Yeah, and I don't know, Jess, if you wanted to answer this one too, because you brought up Catholic hospitals, so that's my next question. But go ahead, Jess.
I would just say anytime, and it's Angela, and I'm sorry, I'm going to go back on some of my compassionate choices experience. But what you see when you make aid in dying illegal, when you don't have these options available, people get real desperate, and we saw increased firearm deaths of people because they didn't think they had any other options. Doctors get real skittish, and healthcare professionals sometimes will get skittish about what kind of questions can they answer. You don't want to have a lawyer in every one of your doctor's visits. Like that isn't appropriate, and it cuts down on conversation. We had a case once at Compassion Choices where we didn't pass a bill in a state one week, and one of our top volunteers, who was an older woman, a PhD from Harvard, shot herself. She didn't want what was ahead. And so she took matters into her own hands. And that's what happens when you limit these conversations. You limit what doctors and patients can have a real frank conversation about. And you also put a lot of people's jobs in jeopardy. Like, I think, Chris, and please interrupt me, like you all had to make some really tough decisions at Planned Parenthood about what you could and could not offer, because we didn't want all of these great physicians losing their medical license. And that's the reality, that when you start stifling these conversations, when people don't feel like they have a place to go and to talk about it, I think things get real desperate real quick. And I think that's something that we see in healthcare. And I think it really screws up the doctor-patient relationship or the healthcare provider relationship, that you can't go in there and it's like, hey, what about this? And I think that has a real serious implication for all of us. Like, we don't want our doctors to not, I have had 6 surgeries in the last 16 months. I don't want my doctors to be scared to tell me what the ramifications are of these side effects. Like, I grill all of my healthcare professionals about, are you pro-choice? And those are things, but, they are also worried about their license and their insurance and all of that. And I think those are things we need to consider. And especially states with rural populations, there's not enough doctors anyway, or healthcare providers. Like, yeah, I think there's a huge amount of concern for me overall as a human being on all of this.
Well, and I was talking with Dr. Deshawn Taylor, who's now been on all kinds of national news outlets. She was part of our secular summit last December. And, she brought up something, and this is a few months ago, but I hadn't really considered this part of it. There's going to be a brain drain. If we cannot train medical students at ASU, U of A, and wherever else there are, pre-med classes or whatever, if we can't train those students in that procedure, they're going to choose different universities. Doctors are going to choose not to open practices here. And I was listening to a piece a while back on NPR about this guy from somewhere in the Midwest, Plains, Oklahoma, something like that. And he was like, I fully planned on, going to school in my home state, serving the rural community in my home state. But now I'm going to go to another state because otherwise I'm only going to be partially trained as a provider to be able to provide people with a life-saving procedure. So it's going to exacerbate the shortage of medical professionals that we're seeing everywhere, and especially in rural areas. And so many of our legislators serve rural communities, and they don't take into consideration these very real problems that people are going to deal with. It's going to make these problems worse. That's just my 2 cents.
Yeah, I want to just jump in and add that, we're already in Arizona experiencing a provider shortage as it is. The fact that these laws passed in the way that they did, with all of the confusion around them, was meant to chill medical professionals, right? To scare them out of doing the things that they normally do, right? So we had to immediately stop operations for all of our clinics in the beginning, and then eventually reopened in Pima County. But we were having an issue finding providers that would do the services in Maricopa County, right? So it's it's the fear, the chilling effect. It's certainly the training issue, which has always been an issue. I remember when I moved out here in the early 2000s, I'd left North Carolina, and at that time, UNC hospitals had already committed to not training OBGYN students in abortions, right? Because they're a publicly funded university in a state that, was not kind to abortion, right? And so we've been seeing these things happen for decades, which is why we have so few providers in the first place. And what we can't do is train a new generation providers if all of our current providers are losing their licenses or in jail. They didn't go to medical school to do that. And so I don't expect them to do that. We need them. We need them out there doing the things that they're good at doing.
Right. And people stop asking doctors to jeopardize their entire careers to do this procedure because, they have the right to be able to, have paid or still be paying those student loans and go through the grueling effort that they've gone through. So please don't expect them to be some kind of superhero, because they deserve to be able to make a living like everybody else, and we don't need them to be martyrs. So just want to throw that out there. Okay, so let's get back to the Catholic hospital question. So when a religious institution takes over a public good, like Catholic hospitals taking over the provision of medical care, how can they ignore the public interest, even, I think it's supposed to be even the law, by imposing their own rules that are contrary to accepted medical standards?
They stand behind the Constitution, right? They stand behind the First Amendment. And, it's a free exercise of religion for them. and they can make the rules that they want to make. And our courts, unfortunately, just keep on finding in their favor, right? I think the most, the largest case that we've seen is under Obamacare, where there was the challenge from the Catholic Church on the provision of birth control, right? And the court was like, it's religious exercise, it's fine, go find another employer. But many patients can't go find another hospital, right? And so that's always been a part of the problem, especially when we're talking about reproductive health care, is that Catholic hospitals and other religious hospitals tend to do whatever it is that they want. And I don't know that what they want is always the provision of the best care in situations for their patients.
And if anybody has anything to add to that, there was a bit of a follow-up question here. Let's see, what did that one say? This one also is about, because it goes along with it. When religious hospitals refuse to follow the accepted, oops, I just made it go away. I didn't mean to do that. Hold on, I got this. Everything's fine. To follow the accepted medical standards, can Medicare or your private insurance refuse to pay them?
Not that I'm aware of. I know that the Catholic hospitals get reimbursement from Medicare and Medicaid, and I think they got like 48 billion the past year in reimbursement. So yeah, so they're using taxpayer funds to deny us our own rights. So
right, and I believe a lot of those laws have some sort of religious exemption in them, so they're not necessarily running afoul of the law either.
Yeah. And I think it's also important to know in a lot of communities that might be the only healthcare available too. And, we need to look at this, I think, pretty holistically about how do we make sure that these laws aren't being oppressive, because, you're not going to tell someone that the only hospital that's available to them are the only specialist they need. We don't want to be shutting those hospitals down or anything, because that might be the only access to care folks have. So I think having strong laws in place, having, maybe strong ballot measures in place that affirm these rights is really what we should be looking for to move forward on this.
So,
and Chris, you can correct me on that if that's wrong, because
No, I mean, that's absolutely correct. It's true.
Chris Lowe says I'm right.
Definitely something that we all want to put on a resume, right? For sure.
Oh, I'm actually typing it in right now, friends. Typing it in. That might be my new Twitter bio.
I double dog dare you, please.
I might just put it up.
Yeah, it's strange times that we live in. Sorry, now I think I kind of forgot what I was going to say, but shoot, I'll think of it again. So I'm going to go back to the questions. The next one I have, let's see. It says, why doesn't informed consent apply to allow adults to make their own medical choices when the result will harm or help no one but that person? That's a good question. I like it.
Oh, that's a lot.
It is. I don't know if we can all answer it here. I mean, but we should, if I found out, I was terminal with Alzheimer's and it was rapidly cycling, I would want to be able that I'm informed about what is going to happen with the deterioration of my brain. I'm informed, that this is, whether it's a viable pregnancy or one that just isn't right for me at this time in my life. I'm informed on all of the, financial implications of having to carry a child to term. And maybe I already have a couple of kids and I don't want another one, I'm informed. So this is a really good question, but I feel like it might be more of a, philosophical or existential question than one that any of us can answer here. And still nobody wants to tackle it. So
I would just say, I think it's all about power and control. That's where it comes back down to, is how do we control people and how do we express power over other folks? And that's what a lot of these laws and restrictions are meant to do. It's power and control, because, as Chris has said so many times, folks of means are still going to be able to access abortion care.
Right.
And so I think why some of these things have been pushing, it's about power and control over folks.
Yeah, if you look at the purpose of informed consent in the context of reproductive health care, there's a list of things that you have to do to prove that you've provided informed consent you've provided your patient all of the information and they agree to it, right? So a lot of informed consent with respect to abortion laws is about having a chilling effect on abortion, getting a person to change their mind, right? So, informed consent, says, okay, you've got to do an ultrasound and find out how far along the pregnancy is, and listen to the fetal heartbeat, and listen to some goofy script that's not medically accurate, and know who you're, know the provider, and then you have to leave and sit on it for 24 hours and then come back to get the services that you want, right? And so that's how informed consent works with reproductive health care. It's meant to make people change their minds. It's not necessarily about making sure that patients are informed, right? Informed about the things that are going on. And so I think that it's an interesting question for sure, especially when we're talking about informed consent with adults and not necessarily a 16-year-old, but they still have to provide informed consent as well. But I think that when we take a look at these laws, we're all about individualism until we aren't, right? And so there are no healthcare decisions in our concept of what this law is. There are no healthcare decisions that don't necessarily impact the body politic, right? So any of these decisions are about, what's in the best interest of the citizens, the citizenry. It's a public health measure, not necessarily an individual decision that you're making. So I find that really weird, kind of juxtaposing that to the rugged individualism we claim to have in every other place. But all of a sudden, when you're a pregnant person and you want to end your pregnancy, then it's about what's best for, what's best policy for everyone in the state. Right.
And I was just gonna. Oh, sorry, Angela, you go.
I cannot figure that out either, the real answer to this. But I do know that in states where we do have medical aid and dying authorized, when talking about end of life care options with their doctor, what we found is that states where it's authorized expands that conversation. So when you first go in and start having those conversations, they might offer a few of them. And even if you're not eligible and you don't meet the requirements to receive the medication, so if you have dementia or Alzheimer's, that's not one of the terminal diseases that would qualify you. But by asking about it, then your doctor will say, that's not an option for you, but here are some other options, like voluntary stop eating and drinking, or we could stop, giving you medication for your heart, or, in some cases, palliative sedation, So it has expanded the conversation, but usually not until those questions are kind of asked.
This makes me think, what you just said too, or what you all said, really makes me think too of some of these things that we're hearing about, where women who are getting chemotherapy, or people who are getting chemotherapy, are now being told, oh, you're pregnant. Sorry, we're not going to treat your cancer anymore. I mean, it's okay, I just don't know how can the life of a fetus have more. I mean, I don't know. We know the answer, and it's power and control, right?
But I think that's about, the federal government has always here, and I mean, the government, period, federal, state, whatever, municipal, has always used this argument that, having families and children is it's a right that's worth protecting, and therefore they need to create policy in order to make sure that they're protecting that, right? But so that's the excuse that they use. There's more than one life at stake here. But in theory, there's the entire political entity and everyone who's a citizen of that That's who they're making the law for, right? It's not about you as an individual or the fetus that you're carrying. It's about everybody else. And so I think that what we need to do is kind of reconceptualize the whole thing, right? And really make sure that we are talking about, putting the patient at the center of this, the patient's life, the patient's healthcare at the center of any discussions. And then everybody else is secondary as far as I'm concerned, or non-existent in my world. In a perfect world. But I think that it's a real, it shows just how our society is of different minds at the same time. And I don't want to use the term schizophrenic because that feels really ableist, but there's a break somewhere in there where we're, when it comes to the bodies of pregnant people, all of a sudden everybody has an interest. But for anything else, it's just your rugged individualism.
Can I just add too, because I agree with what you said, Chris, but for medical aid in dying, only the terminally ill person's life is being impacted. And so that is why it's even more like bizarre to me. And they're dying. They're going to die. Like that is the fact that it's not suicide. They're going to die. This just, if that person chooses this option, that is the choice that they're making to have what they would consider to be the most peaceful death for themselves. So it is very confusing to me why there's opposition to that. So,
well, even further, I think that it's weird that we won't allow people to make those decisions for themselves, but hospitals make them all the time. Mm-hmm. And to take a look at what happened with COVID, where they were kind of picking and choosing who won the lottery to stay in the hospital, right? Hospitals make life and death decisions for folks every single day and don't even bat an eye at it. So I don't understand why we can't make those decisions for ourselves.
Well, and we can make some of the choices too. Like we can say, like, I don't want to be on a ventilator. So we do already have those options. They just stop at the medical aid in dying usually. So.
And I would just add to this, part of why informed consent happens, like anyone who's had to battle their insurance company. And, in the last year, I have probably spent most weeks about 15 to 20 hours on the phone asking for things to be covered that should be covered. It's a way to break people down. It's a way, the people who can get like multiple medical procedures done before getting the one that they want, need, and deserve the right to access, having all these barriers, it's to break people down who have trickier work schedules or lower income or transportation issues. It's a way, just back to power and control, but like adding all these barriers, it's to make it just harder, and it's to break folks down.
That I was just going to ask too, at this point in our conversation, it just feels so obvious now that this is because of a powerful, influential healthcare lobby, pharmaceutical lobby, whoever has their hands, in the, grabbing for some of the pie, because if they can make sure that people live longer, well, they're going to have to utilize, more healthcare services, go to more doctors, whatever. So how big of a part would you all say that the healthcare lobby plays in this? How much of this is religion? How much of this is capitalism?
It's
how much
all capitalism, baby. All capitalism.
Well, we know this. Yes, we know this. Yes.
Chris, I want to see that t-shirt soon.
Oh yeah, it's backwards, but it says fund.
Oh, I see. Yeah, no, I want you a capitalism baby.
Oh, I need a capitalism baby t-shirt for real.
It's all capitalism baby. I would like that t-shirt.
White capitalism / white supremacy, right? Yeah. I think that people are capital, and when they become useless to the society, they'll do all of the things that they need to do to either get rid of folks, which is like picking and choosing who gets to live and die, right? They'll do the things where they want to make sure that people are producing more little worker bees. So that means, placing barriers in front of people who want to terminate pregnancies. So it's all, the lobby, religion, all of it together. It's just now a political issue, but everything is a political issue at this point. I don't see anything that's not a political issue. So yeah, I don't know that, you can untangle it. Like, I can't do like a 59% capitalism, 37% religion, because it's all intertwined in a little ball.
I'll also just
go ahead.
Oh, I was just going to add that, so Catholic hospitals are about 80% of the religious hospitals, and they have ethical and religious directives. And so similar to the story that you shared earlier about the state legislator who said that his mother had passed away and it was really painful, like that's part of the religious directives in a Catholic hospital. And so what we try to do is also just educate people. Like, if that's the way that you want to go out suffering, like that, good for you, good on you, like it isn't my choice, but if that's your choice, that's fine. But we just try to educate people. And we have resources too, like how to find a partner doc and stuff, just so that people know to like ask these questions ahead of time so that they can, again, make the informed consent. Do I want to be in this hospital? There's different, advanced directives that you can complete so that you can be moved from a Catholic hospital if you end up there to one that's not, that will honor your wishes. So, I mean, they do have this. It's kind of scary if you go and you can Google it and read all about it if you would like. But it isn't something that I would want done to me.
It makes me think back. This was before COVID. And maybe they've started it back up again, but there used to be at Changing Hands bookstore, it was like a secular book club or a humanist book club or something. It was Senator Juan Mendez who organized the book club, and every week they'd come, somebody bring up, they'd read a book, whatever. And then, I remember at one point somebody saying, well, and this is the part where we get to the realization in the book that, everything is the fault of capitalism. So, capitalism ruins everything. And so, yeah, it was, that was like a frequent thing that would come up, because as we're analyzing these very academic books, we can kind of see the systems at play. And it really is about power and control. I mean, even in Georgia, I don't remember who it was, but somebody said, yeah, no, we don't care about his, abortion from however long ago. We don't care. As long as we, get the Senate, that's all we care about. And it's happening here in Arizona. We have a countywide candidate here in Maricopa County that yesterday it was revealed that he was doing something, lewd in one of his campuses that he wants to, be running in close proximity to a child care center on that campus. And I haven't heard one single Republican denounce him. Not one. I haven't heard one member from his own party say anything. And when the same thing happened in the Democratic Party, boy, there sure were a whole bunch of us that came out immediately and said, wow, I had no idea, but I have nothing to do with this guy. He needs to step down. So the hypocrisy is glaring, and it really is all about power and control, as long as they have power and control.
And I don't want to keep, but I do want to just put out there that most of the staff and the teams at hospitals, religious or not, are really providing great services to the patients. And I think this is a bigger thing than individual hospitals or individual religions be influencing the role of hospitals, because, God, the healthcare workers that are out there doing the work that needs to happen every day. I think we need to also just take a moment, like there are really quality folks working in all these hospitals providing great care, but we need to fix the laws so that they can do their jobs and patients can have the services and have the medical care that that they want and deserve. So I just always have to, there are very, nurses and doctors and hospital administrators to, the folks who are figuring out the diet at hospitals are really doing a lot of work right now and under really stressful situations. And I think it's up to the state and the body politic to really fix some of the structure so that they can continue to provide for their patients.
Thanks, Jess. I just wanted to echo that we feel the same way at Compassion and Choices, that Catholic hospitals can provide amazing care and services, and the healthcare workers are amazing. And also, when we have done national polling, 70% of Catholics do support medical aid in dying. So we're just strictly talking about like the Catholic Church and their policies. So,
and those policies of the church dictate the policies of the hospital. So, I forgot what I was going to say. Shoot, I need to write these things down the minute they come into my head. Oh, I remember. It was I can't remember her name now, but she is the head of the Arizona Nursing Association, and she was telling me, we had a phone conversation. She was telling me how the nurses, the healthcare workers that she works with on a regular basis, have just been so kind of put through the ringer, you know, these past, 2.5 years, however long this has all been going on. We both talk, you know, because my background is in education, and in the very beginning, you know, in March, April, May of 2020, it was, you know, we were put on a pedestal, and, oh, thank you, teachers, thank you, healthcare workers, thank you, you know, Fry's employees or gas station attendants or whatever, frontline workers. And now all of that has just gone so far out the window. And some of the stories that she shared with me that some of her nurse colleagues talk about are just unbelievable. I never thought, I really didn't, Chris Love. I never thought that I would live in this time where teachers are seen as, you know, not having a child's best interest at heart, as being somehow an enemy that you see fit to attack, and that nurses and healthcare providers and doctors are seen in the same way. Well, and any expert, really, you know, I've gone to the Capitol many times and seen people who are the head of their superintendents association, the head of the counties, talk about why, no, please don't do all these, you know, these election bills, because it's going to be, you know, the counties won't be able to handle it, but they don't listen and they don't care. And it's just, again, goes back to the idea of power and control. But, you know, it makes me wonder too, who's going to, you know, these folks need a doctor and nurse and a teacher to teach their kids. Like, what are they hoping for when they target these people? I just don't understand. Again, another philosophical question. And just so y'all know, I'm not seeing any questions in the Q&A, so I'm going to see how many more we have left here. Let's see. Okay, so here's one about the 14th Amendment. The 14th Amendment says we cannot be denied the protection of the law based on membership in certain groups. So how can women be denied the protection of law, whether HIPAA or informed consent, under the Dobbs decision and the Texas bounty hunter laws?
Did Diane write that question too?
She sure did. She sure did.
Tell Diane I know all her questions. Yes. She's correct about what the 14th Amendment provides protection, but I think we also know that gender is, in the protected classes, in the hierarchy of protected classes, gender is somewhere in the middle, right? So any gender-based case usually receives an intermediate level of scrutiny, as opposed to strict scrutiny for things like race and, you know, well, military status and disability and all of those things, right? Gender receives this medium level of scrutiny by the court. So when they're looking at any regulations that directly impact person because of their gender, then it receives this like lower level of scrutiny. So, you know, women are always going to be second-class citizens. We even get less scrutiny than anything else, right? So I think that it is wonderful to rely on the Constitution or precedential interpretations of the Constitution, and we just saw Roe get tossed. And every constitutional argument that was made and that was a foundation of Roe got tossed with it, right? So, you know, how can this happen? Well, it's happening, right? It is happening. And I just feel like at this moment in time, with the Supreme Court that we have, with, you know, kind of the extremist state legislatures and state governments that we have. And I'm saying this as an officer of the court. I feel like we're in a state of lawlessness at this point. I don't feel like I can put any comfort in knowing that what's written in the Constitution and what the jurisprudence around these things have been for decades, for generations, I don't trust it anymore. I just don't trust our court to make the correct decisions based on the precedent that we have. So how can it happen? It's because we got the wrong Supreme Court.
And just as the not lawyer talking, but I do think these questions might prep me to maybe take the LSAT one of these days. Belts and suspenders, I think is important. Like we see things changing. We see what Chris was just mentioning about the Supreme Court. You know, so we need to get these laws down. We need, you know, Arizona definitely needs this. And again, I'm going to keep going back to the ballot measure process, but we need to protect this ballot measure process in Arizona. And we can put in the chat, but, you know, we need folks here to sign up for Will of the People AZ. This is the group that we formed to fight back on the Proposition 128, which will make it that the courts or the legislature can overturn parts of ballot measures they don't like. 129, which would be single subject, which with the Arizona courts could be interpreted as single statute. So on a marijuana ballot measure, you might be able to make pot legal, but a pipe might be illegal. That seems really dumb. And that could have bigger effects on any other ballot measure that we would do in Arizona. And then 132, which is 60% threshold. And they've written it purposely to be confusing. They talk about it's for any tax. Arizona is a revenue neutral state. So that could have an effect on any ballot measure. I think it's really imperative that we get folks voting no on this. I think this is one of the biggest things if you want to see choice codified into law in Arizona in a way that is helpful. Fighting back on these ballot measures is one of the biggest things you can do this year. It's, you know, these are not getting a lot of attention right now. We're fighting as hard as we can, and we can put it in the chat. The Will of the People Arizona Healthcare Rising, we're doing a lot of the field activities around it. But I really cannot overemphasize this enough since I have folks on the phone on a Zoom that care about this. This is like one of the biggest things we can do this year to protect choice moving forward in Arizona.
And would you maybe just repeat those again? And if you, I'm looking for the link myself, but if you
I just put it in the chat when I first started, just because I knew I would lose it. Let me see if I can do it again.
I got it. No, I have it. Okay, so say those just real quick again, and whether people should vote yes or no on. I think it's no on all of them.
All three I just mentioned is no. So okay. Proposition 128. This is one that would allow the courts or the legislature to overturn parts of ballot measures they don't like. Yep. Vote no there. Proposition 129 is single subject. So that would, which we're worried the courts would interpret in Arizona as single statute. Mm-hmm. And then Proposition 132 is a 60% threshold on ballot measures. These are all, folks need to vote no on this. Folks need to talk about this. It's not getting, there's 10 ballot measures on the ballot this year. Oh, that's so micro, it's macro, or so macro, it's micro. I don't know which way I went on that. But, you know, people need information on these. Ballots are already out. And so everything you can do to fight back on these are going to be the most, I think, really important for, you know, having an option. The legislature is not going to pass a pro-choice bill in Arizona, is my guess. And the other benefit ballot measures have is that they are voter protected right now. Of course, 128 could take that all away, but we want to protect ballot measures. So, you know, I really, every time I have a chance to talk about this, I'm going to mention it, even if it's off subject.
No, I'm really glad that you did. Yeah, I'm really glad that you did. I also put in the civic engagement beyond voting 2022 ballot guide that has a breakdown for some of the candidates, the judges, the ballot initiatives, and then scorecards for some of the elected officials as well, so folks can access that. Well, since we are at 7:01, I'm going to go ahead and make the executive decision to end this. This has been a really, really great discussion. I definitely appreciate you, Jess, bringing up all the ballot initiatives, because it can be confusing. That the one about the 2/3 majority is especially rage inducing because of how they're trying to market it to people about the taxes. And so I have a feeling that a lot of people are going to be fooled with their rhetoric, but who knows? I'm not making any predictions at all this cycle.
I want to add that one is really very important for us. And I mean, the no campaigns are important to Planned Parenthood as well. But that one is really important to us because we know that even though an overwhelming majority of Arizonans support abortion rights in some forms, having a 60% threshold will be really more difficult for us if the legislature does something like goes back and amends the 15-week ban to include rape incest exceptions. I think that some people are fooled into the idea that 15 weeks sounds reasonable. It's not. It isn't. And I think that if we are facing a 60% threshold moving into 2024 with the ballot initiative, that could be a serious challenge for us. So vote no on that shit. Sorry, I cursed. It was going to happen.
And I'm surprised it took this long.
I know.
But I don't think this is hopeless at all. Like, I wouldn't be, what I would have to say on these ballot measures, why it's really important that folks are on this Zoom talking about it. Ballot measures are, people are looking for trusted friends, family, validators on this. So, I included the website for Will the People. Sign up. We will get you, things that you can put on your social media. Those things are really important for low information campaigns right now. And we need folks knowing that how bad these are. And as Chris said, 60%, that is a hard threshold. And it's hard, Arizona campaigns are hard. Arizona is the hardest state in the country for passing ballot measures and getting on the ballot. I have gone through this 3 cycles now, and this is not easy, fun, or it's fun, actually. It's quite a bit of fun, but it is not easy. It is expensive. And, but if these restrictions pass, it's going to have a chilling effect on ballot measures in Arizona. And we need this. Arizonans are way more progressive and way more, not just progressive, but way more looking for solutions than our legislature would have you believe. And so if we cut down our options on ballot measures, we're not going to have some of the great policies and the freedoms that we need. And, I think it's just whatever folks can do to help us pass or defeat these propositions is going to be really important for us moving forward. Also, I just need to do a little, Prop 209, the medical debt one, is also a great one. Please vote yes on that one. When I say vote no on everything, not everything else, but 209 is, showing that we can pass things that have to do with healthcare and medical debt will have a really strong effect on what we decide to do as a community in 2024.
Yeah, and there's all of them are listed on CEBV. I put the link in Facebook. I put it here in the chat. I appreciate all of you very much for taking time out of your busy schedule, especially during an election cycle. So thank you for taking time on your Wednesday, and thank you for this really fantastic discussion. Anybody want to say anything before we go?
Thanks for having us.
Of course. My
This was
pleasure.
a lot of fun.
Thank you.
It's always a pleasure. Oh, also vote for Jeannie Castine.
We're a nonpartisan organization. And
we're not a partisan organization, but there is one really great secular candidate that is also pro-repro. I'm just, not going to say what party she belongs to or who she is, but if you're voting in Legislative District 2, you should choose the person who is pro-repro.
All right. All right. I'm not saying a word.
Also look at who's been endorsed by Healthcare Rising Arizona.
There you go. And Planned Parenthood advocates.
Yeah.
I kept it C3, Jeannie. I kept it C3.
All right, everybody. Well, with that, you all have a wonderful night. Thanks for everybody who took time to join us tonight. And let's see, Friday. I don't have it in front of me, but we're going to be talking to somebody really amazing on Friday. Oh, right. We're going to be talking about judges on Friday. So if you're not sure who to vote for, who to not vote for on that very lengthy section of your ballot about judges, we are going to be having a discussion with somebody who knows all about it. So join us at 12 o'clock on Friday, and we'll see you all the next time. Take care. Bye-bye.